Well, thank you. November is Lung Cancer Awareness Month, and while this cancer is the second leading cause of death in the United States, it's actually the leading cause of death among Hispanics. Here to talk to us about raising awareness, Dr. Thomas Klein with Good Samaritan Medical Center. Thanks so much for being with us. Let's start with the big topic of there's a common misconception. The only people who get lung cancer are those who smoke. Not true.
Right, it's absolutely not true. And because lung cancer is such a common disease, even though only about 10% of people with lung cancer are non-smokers, that still comes out to about 30,000 people each year, which is a huge, huge number.
And secondhand smoke, also a very big thing.
Right, absolutely. Being around smoking and other risk factors absolutely factor into all of this.
And we wanted you here today because new guidelines just came out. Explain these new guidelines. Who does it affect?
Right, so this is a big change to the way we deal with lung cancer. Up until now, people who have been diagnosed with lung cancer usually have been at advanced stages, but we now have new screening tools that allow us to start doing annual low-dose CAT scans to help identify people at risk for lung cancer.
The first thought everyone thinks is, how am I going to pay for that?
Right, and the good news is that now already Medicare is covering it, and private insurers are picking it up as well. As it is, even out-of-pocket costs are fairly reasonable for this screening. It's usually under $100 for an annual screen.
And so just like women should have their annual mammograms, smokers, or is this everyone?
So it's smokers.
Okay.
So people 55 and older who are current or former smokers should be talking to their doctors about whether lung cancer screening is right for them.
And right at the top, we were talking about who's actually affected. It's the leading cause of death among Hispanics. Why do you think that is?
So, by and large, it ties in with smoking history. So the more people smoke for any group of people, the more likely they are to develop lung cancer. But there are also genetic factors at play that may be contributing in some way. One
of the greatest things, I guess, about quitting smoking, your lungs can come back, right?
Right, absolutely. So
never too late.
Right. So quitting smoking dramatically reduces your risk of lung cancer. So if you are a smoker, the single best thing you can do for yourself is to quit smoking. But if you can't quit smoking, you should definitely be going for your lung cancer screening.
All right, sounds good. Thanks so much for joining us. Good information there. We'll be right back.
Thank you.